2022 Oscars will be always remembered for the slapgate. It was an unfortunate incident, but Chris Rock made fun of Will Smith's wife Jada for her alopecia. Today we'll actually speak to Dr. Soumya Jagadeesh, who is actually our dermatology professor. She's an expert on alopecia, and we'll just find out what are the different forms of alopecia, what is alopecia areata, what can be done for that, what is the treatment, how effective the treatments are, and everything that you want to know about alopecia. Hi Soumya.
Hi.
Soumya, what are the different types of alopecia? Is alopecia a common term, or can you just explain something about alopecia?
Sure. Alopecia is like a non-specific umbrella term. It's got a Greek etymology. It just means hair loss. But the issue that we're discussing today, I guess, is alopecia areata, the one that
Yes.
the recent controversy.
Correct.
Alopecia areata is a specific kind of hair loss. The terminology is used for an autoimmune etiology, where your own immune system is working against your hairs, the hair follicles, and cause destruction of hairs. So, which is why it manifests as hair loss.
So all the terms that are actually in the media currently regarding Jada's hair loss is specifically for alopecia areata.
Yes, it's about alopecia areata, and alopecia areata itself is only another term. There are subtypes for alopecia areata also.
Okay.
Like we have alopecia totalis, where the whole of scalp hair is lost due to alopecia areata, and there is alopecia universalis, where you lose the body hairs, the eyelashes, eyebrows, the whole of scalp, all the hairs are lost.
So how do you differentiate between alopecia areata and a regular, say for example, alopecia regular this one hair loss, no? How do you
Regular
differentiate?
hair loss, yes, definitely. You're also an expert on that. I guess especially when you compare with balding or androgenic alopecia. Balding is quite common in teenage years, especially in boys. Whereas alopecia areata, there is no such sexual predilection, and it can occur at any age, and it's more common in children. And what you typically see are patches. Patches of baldness anywhere on the hairline. Whereas in case of baldness, you see it more on the frontal area.
Correct.
There is that frontal recession that happens.
It's a pattern
It's a pattern hair loss. Whereas here there is no such pattern. And though we say that it's quite commonly seen as localized single patches, which is, even spontaneous regrowth can occur, this can progress to involve your entire hairline in certain cases. Not very common, but yes, it can happen.
So there are actually not many treatments were available for alopecia areata.
Right.
Now is the scenario changed? Has the scenario changed? Is there any other treatments that are available for alopecia areata?
You're absolutely right. So there are a lot of treatment options available right now. We don't talk in terms of a cure, like you take a particular treatment for 2 months and this will go away forever. Not like that. But alopecia areata, the good thing, as you know, is it's a non-scarring alopecia. Which means that this hair loss can anytime, there is a potential to reverse for even full regrowth. So most of the treatments that we do for the severe forms are in line of lines of immunomodulation, because here your immunity is causing the hair destruction. So when you give immunomodulators, earlier we used to give steroids, which used to have more, we used to be concerned, especially in children, the other adverse effects, but we have better drugs, targeted therapies have come into play, and we also have topical immunotherapy, which we use a lot in children, which gives excellent results, and it can be even continued for a long time. So long-term treatment is important.
So the treatment scenario has completely changed over the last, I think, maybe 5 to 10 years.
It has changed totally, yes.
So the people who are having alopecia areata have got something to smile. Definitely they will be having some treatment options.
Definitely there is hope in the horizon, but we need to work up the other causes as well, associations as well.
So another question is, like, can a person who has got alopecia areata, can the person expect to get complete hair growth like it was like previous?
Very much. We do see it. Not only, it's a reasonable expectation.
Is there some other associations with alopecia areata, some other diseases along with alopecia, because it's autoimmune?
Yes, it is. Autoimmune etiologies definitely is there. So we have to work up for other autoimmune diseases, thyroid disorders, arthritis, lupus, atopy, allergic diseases. These can all be commonly, and nail involvement may be there. So all these things have to be, this will be usually worked up by the treating doctor. And though I said spontaneous regrowth is possible, full regrowth is possible, it's not a rule. There are bad prognostic factors like chronicity. If it's a long-standing alopecia areata, the potential for regrowth will come down. So early treatment is important.
Okay. But then definitely people should, I think, they still have some hope, right?
Absolutely. That's a good point about this controversy, because it came more into the awareness and the public domain. So people I guess more people are reading about it, and yes, there's definitely a lot of things that have happened in the recent years.
So I think in this particular scenario, I just we'll just conclude telling that there is a big potential for treatment of alopecia areata, and there's a good prognosis for them also, right?
Right. As far as treatment response goes, there is good prognosis, but it might require continued treatment. And awareness is important for early treatment.
Okay. Thank you very much, Soumya.
Sure.